Trinidad and Tobago and the wider world. Welcome and thank you for joining us for the Ministry of Health's virtual media conference on the national COVID-19 response today, Saturday, 8th January 2022. Our presenters for today's update are the Honorable Terence Dayal Singh, Minister of Health, Dr. Adesh Surjasingh, Director in the Directorate of Women's Health, and Dr. Kiran Suraj, Head of Department, Adult Emergency Department, Eric Williams Medical Sciences Complex. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will be the moderator for today. We begin with Dr. Surjasingh, who will provide the latest clinical statistics for the parallel healthcare system, followed by a presentation on COVID-19 and pregnancy. Dr. Surjasingh, good morning.
Thank you, Mr. Alexander. Good morning, Honorable Minister. Good morning, Dr. Kiran Suraj. Can I have that clinical update slide, please? So I'm going to be presenting these statistics, which are our updated COVID-19 dashboard as of yesterday evening. This is update number 962 of 7th of January 2022. And at the top of the graph in purple, you'll see that the number of fully vaccinated persons are now 48.1%, which represents 673,000 persons, 199 persons. In terms of boosters administered, we have 85,928 persons. New positive cases as reported yesterday for the period 1st to the 6th of January, 974. There are 67 total patients hospitalized across the hospitals and step-down facilities. Yesterday, we again, unfortunately, saw 18 reported deaths, and condolences go out to their loved ones. This brings the total number of patients who have died since the start of the pandemic to another milestone. We have crossed now 3,000. We are up to 3,010 total deaths. The number of active positive cases are 16,119. In terms of vaccination status, there's a pie chart there, that circle, which in light green, you'll see that the fully vaccinated persons represent just 14% of the patients who have made it to hospital. The vast majority who have ended up in hospital remaining not fully vaccinated at 9,607 persons. In addition, in terms of the deaths that have occurred, 165 of these occurred in persons who were considered fully vaccinated, as compared with 2,455 unvaccinated or partially vaccinated persons since the start of the pandemic. You can come back to me, please. Just giving some additional data. Now, all of this data is published on the Ministry of Health's official website, and you can get the additional breakdowns. In terms of patients' recoveries, there are now 76,941 persons who are fully recovered. In terms of COVID testing, the total number of tests conducted in public and private facilities are 523,225. Currently, there are 447 patients in the hospital setting. This includes ICU, HDU, and there are 160 persons in step-down and transition facilities. The total number of positive cases since the start of the pandemic is 96,070 as of yesterday. I would like to now move on to my update on COVID-19 and pregnancy. So if it's possible to have those slides, thank you again. Right, so I'll be giving an update on some information related to pregnancy and the obstetrics and gynae services. Can I have the next slide, please? Right, so I'm able to actually give you a summary of some important data for the statistics for the year 2021 in terms of the annual number of births that we saw. So this is preliminary data. We still have to verify a few of the numbers, but in total, we had 14,840 births in the year 2021, which is slightly less than what we saw in the year 2020. It's important to note that more than 90% of these cases of deliveries are occurring in the public healthcare sector. 13,384 deliveries were in our very own public healthcare sector. And these cases included those very high-risk mothers with high blood pressure and other complications, including those with COVID-19, as well as all those patients who require neonatal care services, which are only available in the public healthcare sector. Can I have the next slide, please? On screen, I have a graph. It may be a little difficult to see all of the numbers, but this represents the birth trends for the last few years as collected by the Ministry of Health since 2018 till last year. It's important to collect data in order to decide on trends and to allocate services and plan our services. In terms of that graph, the year 2018 is actually represented by the top line, and the lowest line represents the year 2021. It's important to note that each successive year for the last few years, we've actually seen a few hundred deliveries less in each year. So it's not specifically a COVID-related reduction in terms of the number of births. Next slide. The next slide actually represented a little better. On the axis below, it shows over time in terms of starting from 2018 going on to 2021. And you can see the graph heads downwards over time. But there's a similar trend every year where there are peaks in services starting around August, going on till November, where we see 300 to 400 more births across Trinidad and Tobago. And we use this data to plan services. Next slide. In terms of what has happened since the COVID pandemic has happened, all maternal and newborn services have remained working and available with the help of this parallel healthcare system. Mothers have been able to access all the services. The delivery units have remained open. We've set up internal systems for the management of our positive pregnant women who need services. All our clinics, emergency services, laboratories, ultrasound services, inpatient care have been kept running despite the challenges. We have also added vaccines on site at most of our antenatal care services, so you can access your COVID vaccines as well as your influenza vaccine. I want to again say thank you, a special thank you to all those healthcare workers and the support staff in keeping these services open. Next slide, please. So this is the slide that shows the number of pregnant women who have had COVID-19 during pregnancy since the start of the pandemic. In 2020, we had 58 cases. In 2021, there was 1,088. We have some further breakdown which shows that in the latter half of 2021, this is when the majority of cases occurred. To date, this is up till yesterday where we have some preliminary data, we've had 8 additional cases. So the total number of cases is 1,154 pregnant women who have had COVID-19 since the start of the pandemic. Next slide, please. And that number is important when it comes to what happens here. Pregnancy is a high-risk condition. Of those persons, 2% were hospitalized in some form or fashion, including going on to the high dependency unit or the intensive care unit. We actually have, as we speak, and I'd not like to go into any further details, we have several critical women who are unvaccinated at this time in our HDUs and ICUs. We wish them well and we hope that things work out. We've had as well in 2021 5 women who would have died in the postpartum period, and these are considered maternal deaths. All of these women were delivered before they died. They had COVID-19 during pregnancy. I can't go into any further details, but these were really tragic circumstances. In addition, already reported in the press, We had one newborn baby considered mother-to-child transmission where COVID-19 was there. However, the baby died as a complication of prematurity, which is one of the things noted worldwide. Babies are being born before time, and the babies succumb from the complications of prematurity. In total, we've had 4 cases of mother-to-child transmission of COVID. One of those was also a stillbirth. Next slide. This one deals with the vaccine program in pregnancy and breastfeeding. Since June 2021, we have approved Sinopharm for breastfeeding mothers. We also have subsequently approved Pfizer for breastfeeding mothers. They are both considered safe by all worldwide authorities and studies. We've also added that women can get a Pfizer as their second dose if they happen to be pregnant, if they started Sinopharm or AstraZeneca prior to pregnancy. All of those approvals came over time. So over roughly the last 4 months, we've had 1,021 women who would have started their vaccines during pregnancy. In addition, because there are some women who would have started their vaccine program before pregnancy, we have 655 women who would have completed their vaccine schedule during pregnancy. And I'd just like to leave with this last slide, which continues to be important. This comes from the CDC in the United States. This is what is being continued to be seen in this phase of the pandemic. Pregnant women continue to make up a significant number of persons in the ICUs across the globe, with a 70% increased risk of death, and relatively small numbers of pregnant women taking up the vaccine. Thank you very much.
And thank you very much, Dr. Surjit Singh. I now hand you over to Dr. Kiran Suraj, who will share some insight into the medical history and some worrying practices seen in patients presenting with COVID at the Eric Williams Medical Sciences Complex Emergency Units. Good morning.
Good morning, Al, Honorable Minister Dr. Surjit Singh, the general public. Thank you for this opportunity to engage the general public and to give my perspective from the front lines from adult emergency. I'd first like to state that the adult emergency department is still seeing significant amounts of patients presenting with COVID-19 type symptoms and being triaged into our COVID pathways. For perspective, if you can go to the next slide, please. The national statistics indicate that 86% of our patients who are being admitted nationally are unvaccinated, and that's the vast majority. We've also noticed, we've seen a similar trend in our emergency department in that the vast majority of patients who present to in our COVID-19 pathways are not vaccinated. We've also noticed that the minority, roughly 14% or thereabout, who are vaccinated typically have milder disease. Want to see the next slide? One of the ways that we gauge severity of illness is our oxygen requirement. And just to elaborate on the point I made previously, in the fact that those who are vaccinated have milder disease, we took an average this morning of patients in our hot pathways who are non-ICU level and averaged their oxygen requirements and categorized it by unvaccinated versus vaccinated. And what we found, and you can see on the screen, is that those who are unvaccinated have an average of a 7.6 liters per minute of oxygen utilization, whereas the few that are vaccinated in our hot pathways that are not ICU level don't require any supplemental oxygen. Additionally, we've also, if you want the next slide, please. We've also noticed a worrying trend in that, looking at the census of our patients who are currently in the adult emergency department who are COVID-19 positive, a significant proportion of patients still have severe disease. And by severe disease, I mean that they require high amounts of oxygen and require some degree of mechanical ventilation or ventilator type care. One of the reasons for this, when we talk to patients, when we take histories and when we go through what has brought them to hospital, is that we realize that many of these patients who are triaged to who experience high severity of disease take a very long time to come to the hospital. Sometimes they may be at home observing their symptoms, feeling ill, observing their symptoms for days on end before coming to the ED. And on occasion, if those patients had presented earlier in the disease process when they first became ill, then we could have made an intervention to alter the disease course for the better. Another worrying practice that we've noticed amongst these severely ill patients is what has happened to them before arriving to the ED. And many of them have chosen to engage in alternate therapies, especially therapies that have at this present point in time, no medical basis, such as hydroxychloroquine and ivermectin. So our advice to the public is a few-fold. If you go back to the slide before, the take-home points from my message are a few-fold. Number one, I want to urge very strongly that everyone gets vaccinated. From the data that I've just presented, many of our patients presenting to our hot pathways are not vaccinated, and those that do get fully vaccinated typically have mild disease. Number two, I'd like to urge the public to seek medical attention early and not wait till it's too late when there's a little less that we can do for you. And the last take-home point is to avoid unapproved therapy and stick to the traditional therapies that are approved by the WHO and are part of our treatment protocols. So thank you very much.
And thank you very much, Dr. Suraj. I now hand you over to Minister Dayal Singh, who will provide the latest COVID-19 vaccination figures and an update relating to the COVID-19 vaccination campaign. Good morning, Minister.
Thank you very much, Al. Good morning to Dr. Suraj Singh. And a very good morning to Dr. Suraj, first time at the press conference. And I want to thank you for coming out here this morning and sharing your experience at the Eric Williams ED. Dr. Suraj presented a slide this morning, which I think needs to be put back up. If it's possible to have the slide where he spoke about the oxygen requirements of the vaccinated versus the unvaccinated with that green bar. Could we put back up that slide, please? And I want to ask Dr. Suraj to go into that slide in some more detail. Explain to the country what is happening with the oxygen requirements of the fully vaccinated versus the unvaccinated, please.
Sure, no problem. What this slide is meant to convey is a comparison of how much oxygen patients use compared to whether they're vaccinated or not fully vaccinated. And the preset to this slide was that patients who are vaccinated, from our observations in the ED, typically have a milder disease course than those who are unvaccinated. So even if they do contract COVID-19, they fare far better than if they were unvaccinated. And one of the ways that we determine disease severity is by their oxygen requirements. We have other ways, but one of the ways that is simple and easy to look at is their oxygen requirements. And this slide, as again taken as current data from this morning, we took a list of all the patients who were COVID positive and looked at their oxygen requirements and averaged them, and looked at the ones who were fully vaccinated, COVID-19 patients, fully vaccinated. Again, they're not that many because not many of our patients who present to our hot pathways are vaccinated, but none of them required supplemental oxygen at this point in time. And we're talking non-ICU patients, whereas those who are not vaccinated typically have a higher oxygen requirement. The average is 7.6 liters per minute, Minister.
Thank you. So, ladies and gentlemen, I think the takeaway message from Dr. Suraj's intervention this morning with data, current data up to this morning, is that vaccinations work. Is that correct? Your disease profile is going to be much less severe, Dr. Suraj, if you're vaccinated. And this is borne out by your level of oxygen requirements. Thank you very much for bringing that graphically to us this morning. It's my duty now to give you the latest vaccination numbers as of last night. 674,197 persons are now considered on the pathway to being fully vaccinated. That is, have had their second shot of a 2-dose regime or have accessed the 1-shot regime. So that represents 48.2% of the population. I think we are all anxious, myself included, when we reach that psychological barrier of 50%. Hopefully, we reach that in the soonest possible space of time so we could save some more lives, as Dr. Siraj has so eloquently put out with that graph this morning. The number of persons accessing boosters, 88,083 persons so far have accessed boosters. If I could have this slide with the booster program. Right. So, ladies and gentlemen, we have, as of today, we have started month 2 of our booster program. I want to start off by saying anyone who missed their scheduled, their not appointment, but your schedule to come in for your booster during the first month of the booster program, which ended yesterday, you can feel free. We welcome you to come in this month and get your booster program, your booster shot. It doesn't mean that if you miss your time, you are not going to be boosted. Please come in and get boosted. Just briefly, because I did go into it in detail on Wednesday, just briefly. Persons who receive AstraZeneca and Sinopharm from the 1st of July down to the 30th of July, you can now come in from today, the 8th of December, down to the 5th of February. We have the weekly schedule there. Just see when you receive your shot and come in and get boosted. If you receive your Johnson & Johnson between the 7th of November to the 7th of December, you come in again today from the 8th of January down to the 5th of February to get boosted. And you can be boosted with any of the 3 vaccines available, which will be Sinopharm, Pfizer, and Johnson & Johnson. Just to remind, those who receive their Pfizer shots, your booster program starts in March, which is basically 6 months. That's the recommended time for boosting after you receive your second shot of Pfizer. So there's no need to worry. You will be boosted according to that 6-month schedule, which will begin in March of 2022. Vaccination sites are open this morning. The sites that are open this morning are, if we have that slide up, the COVID-19 weekend right. So at North, the paddock is open. Central UTT is open. In the East, Costart is open. Wallerfield is open. Larry Gomes Stadium is open. South, Sapa, Southwest Regional Indoor Sporting Arena, and DB Health Center. In addition to these sites, other sites are open Monday to Friday, including 109 health centers. So please, if we want to have an impact on this COVID-19 surge, it is not too late to start your vaccination program. It is not too late, and we could have a very positive impact on these terrible numbers in about 2 weeks if people decide to get vaccinated. So make yourself available to get vaccinated. Make yourself available to get boosted, most importantly, because all the science will tell you, Dr. Siraj and Dr. Sirju Singh, that one of the best layers of protection against the Omicron variant that we are seeing around the world is to get boosted. So those persons who already have first shot, second shot, your extra layer of protection against Omicron is to get boosted. For those who are not yet vaccinated, you need to start that journey and then get boosted so that you could have the maximum possible protection against the Omicron variant. And let's think ahead. We don't know what other variant is going to be facing us. So let's think ahead and make that wise decision today for the unvaccinated to start the journey for vaccination, and for those who have already been vaccinated to get boosted. So Al, those are my messages this morning, and I thank you for the opportunity, and we can now go on to questions and answers.
Thank you, Minister. And as the Minister said, our panelists are now ready to take questions from the media. In keeping with our format, we ask our media representatives to state their name and the name of the media house before posing their questions. We will take 2 questions per media house. During the first round of questions, and kindly pose one question during all other round of questions. We start off with Guardian Media Limited.
Hi, morning everyone. Rashad Khan here from Guardian Media Limited. Both my questions this morning are for the Minister. Firstly, Minister, I want to know if you'll be in a position to give some clarity when it comes to the public sector becoming a safe zone. I just want to know what will happen to employees who aren't vaccinated but would have had prior COVID-19 infection within that 3-month period. Would they be given until the end of that 3-month period to get vaccinated, or how does that work? And my second question is that I understand that with the EMT that would have been held in connection with possibly fraudulent vaccination cards, that there seems to also be some ties within a certain regional health authority. Do you have any more information on that? Thank you.
Thank you very much, Rashad. I'll answer both questions. So the issue that you have raised is one that is engaging the Attorney General. The Attorney General did come to our offices on Tuesday to trash out those things, and I advise that we wait until the legislation and the regulations come out to deal with those issues, and he has said so publicly. So let the Attorney General take all those views, because what you have asked is the exact same question we discussed on Tuesday when he came to our offices. I wouldn't like to preempt either the legislation or the regulations. On the issue of the EMT, that is in the public domain. It's at the Eastern Regional Health Authority. And as you know, once a matter is engaged in police attention, I tend to be very silent on it, so that the main thing is that the TTPS is involved, and let's let their investigation evolve. But I would not be speaking publicly about it. I don't want to jeopardize the investigation. Thank you very much, Rashad.
Thank you, Minister. We move to azpnews.com.
Hi, good morning. This is Suan Wayo from azpnews.com. Staying on the public sector issue, some companies are withdrawing some private companies, that is, are withdrawing vaccination policies based on public/union intervention. Given that we have over 3,000 deaths, hundreds of cases daily, what concern, if any, is this for the ministry, and can the government do anything with respect to that, given that this may actually slow down the vaccination rate going forward? And if possible, can you give us a recent update regarding the vaccination of public sector workers, given that we have a January 15th deadline? Thank you.
Thank you. Thank you, Suan. So the issue of private companies is one that is engaged in the private sector and the chambers of commerce. As Minister of Health, it is my duty to just encourage people to get vaccinated for all the reasons we have been putting forward. It saves lives. It saves you from needing 7.6 liters of oxygen per minute, as Dr. Suraj said this morning. It will save you from becoming an ICU statistic, and it will save you from becoming a fatality statistic. I would not be commenting much on the issue of the private sector and their policies. That's for them. So that's a private sector issue. But we encourage people to get vaccinated. All the evidence around the world speaks about that. Yes, your second question about the uptake about public servants. Yes. So since January the 3rd, we have had 2 dedicated sites or lines for public servants. One at the Government Plaza down at the end of St. Vincent Street, and one at Sapa, which is open to the public but had 2 separate lines dedicated only to public servants. The numbers that we have tracked from Monday to yesterday at these 2 sites alone tells us that 1,109 public servants have accessed these dedicated sites to public servants to start their journey with their one shot, 1,109. It does not mean that they are not accessing vaccines at the 109 health centers or the other mass vaccination sites. These are just the figures I have, which is indicative of what is going on at the government campus and the 2 lines dedicated to public servants at SAPA. So the figure is probably more, but this is what I am trapping at those 2 sites alone. Thank you very much for your question.
Thank you very much, Minister. And we now go to TTT. We're ready for your two questions.
Good morning, everyone. Hello?
Yes, go ahead, please.
Okay. Good morning, everyone. Kimberly D'Souza, TDT News. A quick question for Minister. Minister, can you just clarify the quarantine periods for persons who may be identified as primary or secondary contacts? We had a question from a member of the public who is saying that she was a primary contact and that she is awaiting results for to find out if it is she has COVID or not. But she just wanted to know if she still has to quarantine or what does she do from there? Thank you.
So that's a technical question, and I
Yeah.
will defer to what the CMO has said previously, but Dr. Surju Singh is here.
Yeah, okay. Thank you, Ms. D'Souza, for that question. Yes, so a lot of the information is actually available on the Ministry of Health's official website. It gives a lot of details on the different scenarios on how long persons need to quarantine for, if they're having symptoms or not, and so on. So it's a little complicated to give over this media, but they should be guided by their county medical officer of health, and the persons are usually in communication with those persons at home. I know sometimes there may be slight delays with the volume of persons, but they can also go in the meantime and check on the Ministry of Health's official COVID-19 page, and all of this information is available. I hope that helps.
Thank you very much, Dr. Sujit Singh. And we will now go to Newsday. You ready for your question?
Good morning, Janelle D'Souza from Newsday. Dr. Surju Singh, how are the RHAs dealing with delivery complications in a COVID-19 setting? And the second thing is with protocols for testing blood with donors, because there have been a lot of complaints. We've been hearing people haven't been able to do surgery because of lack of blood and that kind of thing. So we're wondering about what are the protocols are for testing with donors.
Okay, thank you. I'll actually try to address both questions. Of course, the first question has to do with complications and so on with respect to maternity services. In general, as I said before in my presentation, all normal maternity services and neonatal services are up and running. Systems are in place. We have all the traditional things that we normally do to keep patients safe and healthy during the course of pregnancy. At the nation's hospital, you will be in a safe environment. We have really a high level of professional, competent staff there. It's been a challenge, of course. Things are a little disrupted in terms of the normal way we conduct business, in terms of the protocols. Visiting, for example, is going to be very difficult, not the normal way. The numbers of persons are going to be restricted. You will be guided at each individual RHA. If you do have a COVID-19 complication, it becomes a little tricky sometimes. We have persons in the parallel healthcare system, as I said, who might be pregnant, and we have obstetricians and gynecologists on call from the traditional system overseeing these patients, so they are being well looked after. I'm not fully aware in terms of the details of the second question, but I do know, and we have been saying this even before the pandemic, we've been trying our best to boost our blood donor services. That's a work in progress. We have specialists on board working on these things right now. Donors may have, of course, been a little reduced during the COVID pandemic. Sometimes this can affect some of the surgeries. So I hope that answers that part of the question. Thank you.
Let me just come in here from a policy perspective. The Ministry of Health, and I thank you, Janelle, for raising the issue about blood and testing of blood. The Ministry of Health has engaged and always engaged Dr. Kenneth Charles, a hematologist, who drives all those policies, right? So it's not something that we are unaware of, but as usual, we ask people to come out and donate blood, right? But Dr. Kenneth Charles is fully responsible and in charge of that, all those issues that you have raised. Thank you very much.
Thank you very much, Minister and Dr. Sujit Singh. And we go to TV6 for your two questions. Good morning.
Good morning, everyone. Minister, first question to you. In terms of, I'm not necessarily looking at the legislative side of the issue of the public sector safe zone plan, as you would have spoken to that. But in terms of the issue of testing, because you could have persons who are vaccinated who may be asymptomatic, and the issue of transmission, even though you made it clear and the government has made it clear, the benefits of being vaccinated in that sense of avoiding the worst of COVID, but the issue of transmissibility.
Jewel, could you speak a little louder, please? We're really struggling to hear you. Thank you.
All right. You hear me now?
Oh, much better. Thank you so much.
All right. Sorry about that. I was just wondering, first question to the minister. Good morning. In terms of the issue of the public sector safe zone plan, in terms of, let's say, testing, or I know the government is looking at, if I'm not mistaken, the issue of testing devices that could be used, let's say, at homes, in the context of, while the government's position is clear on vaccination, avoiding the worst of COVID and so on, but the issue of transmissibility, is that something that would be factored into that aspect of the public sector safe zone plan? That's my first question.
Second question, ask you two questions.
And the second question would be, in terms of the issue of, we did hear earlier the presentation in terms of oxygen, but I'm wondering in terms of those trained to deal with that issue specifically in terms of making sure the levels are correct and so on, if there are enough persons dealing with that, do persons additional resources in terms of staffing required for that? That's my second question.
Thank you, Joel. So I will deal with the first question and part of the second question, and Dr. Suraj will come in with the technical part of the second question. So the issue of testing for the safe zones, as I indicated, the Attorney General met with the Ministry of Health on Tuesday. And all of these very good issues that are being raised, all of these things were discussed on Tuesday. And let us wait for the legislation/regulations to see how the legislative arm of this thing is going to work. But believe me when I tell you, the Attorney General, together with myself, the health team, did address all of these issues that you and others have been asking about. And let us wait for the legislation/regulations as we move forward. On the issue of oxygen levels, yes, people are trained to read oxygen levels and so on, but I will turn you on to Dr. Suraj because there's a technical, operational issue that he could speak to, and I'm glad he is here this morning.
Hi, good morning. I will just make comment on as to how that works in our ED at Adult Emergency at Eric Williams. And we have a system where we have an oxygen bank adjacent to our checkpoint or our tented area. As of this morning, we have 71 oxygen tanks available for use. And in addition to that, we have a system of accountability where we have persons inside who regularly check patients' oxygen levels, who are trained as EMTs, check oxygen levels, and also check the amount of oxygen in the tank for each patient at a regular basis. And then they have and they are empowered to engage the persons such as escorts who deal with the oxygen interchange.
Let me just come in here now to just give you the policy perspective. Knowing that oxygen is a critical ingredient in treating with COVID-19, the Ministry of Health, through the Emergency Operations Center, which I chair, those meetings every Monday, Wednesday, and Friday, we took a decision last year to relook at the whole issue of oxygen requirements and needs. One of the measures that we took into consideration, already implemented, to decrease the need for manual operation of oxygen tanks, and I was at point 14, as you know, just before Christmas. We worked with our major oxygen supplier, Massey Gases, to put in what is called VIC tanks, which is a big storage unit for oxygen, which is then piped automatically to the patients, reducing the need for manual intervention to monitor and switch over from tank to tank. 3 Vic tanks have been installed, one at the Point Fortin area hospital, which is a sort of step-down facility where people just need oxygen therapy for 3 or 4 days. Another one is being installed at St. James, and we have a 3rd Vic tank to be installed at another of the facilities. What this does is significantly reduce the need for manual intervention. So I thank you for raising the issue, and you got it from a policy perspective. And we go back to Dr. Siraj.
Thanks, Minister. I just wanted to add one more thing to what I said earlier. And one of the strategies that we use to conserve or to maximize our oxygen usage is the installation or injection of oxygen concentrators. So at present in our adult emergency department, we have 8, and those are used to generate low levels of oxygen to patients who don't have high oxygen requirements. And it allows us to conserve tanked oxygen for other patients.
Thank you very much, Minister and Dr. Suraj. And we now go to a follow-up questions. We will start with Guardian Media Limited.
Hi, morning again. This time my question is for Dr. Surju Singh. Dr. Surju Singh, have we seen any sort of adverse reaction among the pregnant population after they've taken a vaccine?
Oh, okay, thanks for that question. So I will say firstly, locally, the answer would be no. However, we, of course, look to the worldwide registry. There is a worldwide registry where hundreds of thousands of persons are registered in this we report up the chain. But worldwide, we have to rely on the data from the World Health Organization, from the United States. The CDC has actually a very good registry, and the United Kingdom, and they have categorically stated at this point in time they have not seen any additional risk to pregnancy or breastfeeding mothers if you take the vaccine. The vaccine has no increase in terms of complications to the mother or to the baby. Thank you for that question.
Thank you very much, Dr. Surju Singh. And we quickly go to azpnews.com for your follow-up question.
Hi again. A follow-up question to the Minister. We have reports that persons very ill are going to pharmacies to get medication. Some are admitting that they have COVID-19. And while it may be a breach of quarantine, they are saying that they don't have the additional human support to have persons deliver medication, etc. to them. While we are aware that agencies and local government have stepped in, what more can be done to assist these individuals who cannot leave their homes but have no additional human support? Thank you.
Thank you. What I advise persons to do, if you are COVID positive and you are absolutely at home and you need medication, there are many pharmacies that actually deliver, home delivery. And I hear them advertising on the radio very, very often. There are many pharmacies that home deliver. There are many pharmacies also that have drive-through. So you could drive through without having to come out of your car, so you are in your bubble. You can rely on a neighbor. So there are all of these alternatives that we could use. Pharmacies are home delivering. There are pharmacies with drive-through, and engage someone who could help you get your medication. Okay? Thank you very much.
Thank you very much, Minister. And we go back to Guardian Media Limited for a follow-up question.
Dr. Surju Singh, just another question from me. What percentage of these maternal deaths that you would have, non-maternal deaths, the maternal infections as well as maternal deaths, what percentage of these would have been vaccinated versus unvaccinated? Do we know?
Okay, well, some of this information is already in the public domain. Of course, for the patients who would have succumbed to the disease, all of these patients were actually unvaccinated. So that again reinforces the need for vaccination during pregnancy. Thanks.
Thank you very much, Dr. Surju Singh. We now go to TV6 for your follow-up question.
Yeah, just wondering, and anyone at the head table who could answer, just in terms of those in the public health sector especially, who've been dealing with the issues in terms of intensive care and high dependency treatment and so on, and just in general, how has the ministry been looking at in terms of ensuring those healthcare workers vital in terms of the war against COVID-19 are not fatigued, or in terms of managing stress and things like that, because I would imagine that would be a very important part of the issue of ensuring that the services are provided as they should be.
Thank you, Joel. So you use the term that they are not fatigued. Let me say upfront, they are fatigued. And I have been saying so months now. Healthcare workers around the world are fatigued. What we are doing at the ministry, months ago, and we have been speaking about this, many months ago, we instituted, even before the pandemic, each government agency, each government ministry has something called a EPA, EPA, Employment Employee EAP, Employee Assistance Program, where any employee who feels they are physically, mentally challenged, needs psychological counseling, each ministry has that program. That is pre-pandemic. Post-pandemic, this response would have needed to be accelerated, expanded, to now, with health especially, consider the emergent stresses being placed on healthcare workers. The Ministry of Health, via the RHAs, not only expanded, multiplied, but through initiatives guided by Dr. Hazel Othello, who has spoken about it here, we have significantly expanded our response to this. As a matter of fact, just before Christmas, when I was visiting one of the facilities, at the Cora facility, one of the consultants said, it is now compulsory at the NCRHA, which carries the bulk of the COVID response, that persons see a psychologist, that persons take part in this. And she was in high praise for that. You may remember around November last year, we had one of the nurses from the ICU at Couva speaking about it. And she was very, she lauded the psychosocial response that the ministry is putting out. So all the support for psychosocial support is there. At the NCRHA, which carries the bulk of it, Professor Hutchinson, is it? Yeah? Yeah. And then we also have, Dr. Surju Singh is reminding me here, and I actually have the flyer. We instituted some months ago under the Ministry of Health, where we brought 30 agencies together under the banner of providing psychosocial support, something called Find Care TT, where anybody, public sector, private sector, can go onto this one website called Find Care TT. And in this one website, you will be guided to 30 agencies. Each RHA, and let me call out some of the agencies here. University of the West Indies, Consortium of Disability Organizations, Tobago Regional Health Authority, Trinidad and Tobago Association of Psychologists, Children's Authority, Lifeline, Ministry of the Sisters and of the Sorrowful Mother, Coalition Against Domestic Violence, Childline, Red Cross. 30 agencies that are available not only to healthcare workers, but any member of the public who needs that type of support. And this pandemic, it is not only the pandemic of COVID, the pandemic of the unvaccinated, and you are right, this pandemic of mental issues. So the support systems are there for both healthcare workers and the general public under Find Care TT. Take advantage of it. Thank you, Joel, for raising the issue.
Thank you, Minister. And may I also add that Find Care TT link is also on the Ministry of Health's website, and so you can find it there as well. And with that, we go to a follow-up question from azpnews.com.
Minister, with respect to the issue of pharmacy, again, a lot of people are seeking to obtain medication, COVID-19 specifically. To your knowledge, are we equipped with enough medication to treat with the increasing patients at home and in hospitals? Thank you.
Thank you. So I could speak to the public sector. I can't speak to the private sector and their stock levels. But in the public sector, at this current time, because that has to be qualified, because you will appreciate there are global supply chain issues. And it's not unique to computer chips to make cars. It's not unique to steel, to containers, to toys, to food, to anything. It's across the board. However, and this person gets no public recognition, so I'm going to do that now. We have a dynamo at the Ministry of Health, the acting principal pharmacist called Ms. Anisa Sibu Dudnath. She doesn't like to be recognized, but you raise the issue. Who from day one has been managing our supply chain logistics under my guidance to make sure we don't run out of PPE, vaccines, syringes, swabs, and pharmaceuticals. Even taking into consideration that other countries more resourced than us have run out of these things. There was one country that was importing used gloves from another country that were bloodied. We have never run out of anything critical for an extended period of time, even in this global supply chain issue. So at the public sector level, at this point in time, because we monitor this literally on a daily basis when the Emergency Operations Committee meets, which I chair, and that is one of the issues and one of the reports that come to us. So right now, as it stands, there is no major long-term shortages of anything needed to fight both COVID and for the normal healthcare system. Thank you very much.
Thank you, Minister. And we quickly go to the Newsday for a final question.
Good morning, Minister Dale Singh. I have a question about the mass storage site. You made a statement to Newsday recently that the position at our morgues at this time is not critical in this case. So I'm hoping you can clarify. And so since the RHAs, that is the case, can we get an idea why the RHAs can't hold on to these bodies until the families come out of quarantine and are able to claim them?
Thank you. So the issue of the RHAs, resources and capacities are finite. So we can't hold on to bodies indefinitely as much as we would like to. So that is why we have to treat all of this with a degree of dignity and have the funeral homes store bodies. Even before COVID, both the NCRHA and the Eastern RHA were, as Davlin Thomas would have said at an earlier press conference, were in the habit of outsourcing some of this. That continues, and we urge families to claim their bodies as soon as humanly possible, take them to the funeral homes so that we could have a smooth transitioning from the public sector into the private sector. Right, so I hope that brings some clarity to the issue.
Thank you very much, Minister. And I would want to thank the media, presenters, and you, the listening and viewing public, for participating with us today. And if you haven't gotten your COVID-19 vaccine as yet, please make the decision to get yours now. We leave you with 2 testimonies from persons like you who decided to take the COVID-19 vaccine. Be safe and goodbye for now.
Crawford Stadium getting my booster shot. I took the vaccine because I'm a medical student and I've seen firsthand that how COVID has affected so many people. People are dying. Please